continue with the capsule and is not present around the neck of femur, and that is the reason why fracture neck femur, they have delayed union. Because if you compare the neck of the femur with the rest of the bone, they are lacking something. They are not having those blood vessels which are supplying the periosteum. Why? Because periosteum is continuing along with the capsule. So the intra-articular fracture, it is not only about the fracture neck femur, all the intra-articular fractures, the fractures which are present inside the joint capsule, they may undergo a delayed union or non-union because of the lesser blood supply. So this is something about the periosteum. Just remember the Sharpey's fiber. They've asked it once. That Sharpey's fiber. What are the collagen fibers? Name the collagen fibers which are attaching the periosteum to the underlying bone. And also do remember where it is not continuing. It is not continuing to the articular surfaces. It is not continuing in the hyaline cartilage. Okay. Now we will talk a little bit about the joints, and then we will jump to the systemic anatomy for now. That doesn't complete the general anatomy today. We are just talking about the bones in the joint today, and then in the next time, like I have kept next Saturday, where we'll keep it, and we'll keep the entire day for the embryology, the histology. So we will keep one full day in which we will cover up the rest of the general embryology, general anatomy, as well as the histology. So it is just to start, we are discussing these topics. Okay. Let's talk about joints. There are many questions which are asked from these joints, and you can see it in your question banks. Guys, joints can be divided into three types. Structurally, joints can be divided into three types. We have fibrous joints, we have cartilaginous joint, and we also have the synovial joint. The synovial joint. Three types of joint: the fibrous joint, cartilaginous joint, and the synovial joint. The fibrous joint, which are not having any intervening cartilage in between. We're calling them fibrous joint because there is no cartilage in between. So let's say there is a bone over here. It is connected to other bone maybe by a membrane or by some fiber over here, but there is no cartilage in between two bones. In case of cartilaginous joint, obviously the name is cartilaginous, we have a intervening cartilage in between. There is an intervening cartilage in between in the cartilaginous joint. The two bones are joined by intervening cartilage. And synovial joints are the one which are having the two ends of the bone covered with the hyaline cartilage, having their own capsule and synovial fluid secreted by a synovial membrane. So as you can see, fibrous joint, where two bones are joined by some fibrous structure; cartilaginous, where we have an intervening cartilage between two bones; and then we have synovial joint, where we have a joint capsule, we have a bone covered with the hyaline cartilage, the ends are covered with the hyaline cartilage in most of the cases, and then we have synovial fluid secreted by the synovial membrane. So we have a synovial membrane as well present inside. So this is what you see in a synovial joint. Let's start with the simplest one, that is fibrous joint. Fibrous joint can be sutural joints. Now, as you all know what are sutural joints, the joints present between the skull cap. We have the joint present between the two parietal bone, we call them interparietal suture, lambdoid suture, we have squamous suture on the side. All these sutures, they do come under the fibrous joint. They do not have any cartilage in between, they do not have any synovial fluid in between, they are simply connected by a fibrous tissue. Next, so sutural joint, obviously all the sutures. Next we have gomphosis.